So in my presentation, I'll try to answer the following questions. Why do we need registries? And what were the steps that were made to create this registry? What variables are included in the registry? And how to use the psoriatic arthritis registry. The first psoriatic arthritis registry was made in 1973, 50 years ago. It was made in Leeds, UK. Before that, we thought of psoriatic arthritis as only psoriasis and rheumatoid arthritis, and this registry helped us to know that psoriatic arthritis is a single disease entity. And also helped us to know that there are risk factors for psoriatic arthritis, like family history, and there are multiple domains of psoriatic arthritis. In the same decade, there is another important registry that was made in 1978 in the University of Toronto by Dr. Gladman. And this registry also added more information to the literature. Since then, there was multiple registries, especially in 1990s after the introduction of the biologics. One of the most well-known registry are the PARC and Corona in the United States. There is also the BR registry in the UK, the Danibo in Denmark, and the German collaborative arthritis centers. This is a world map which looked at the psoriatic arthritis registry. You can see the darker the number, the higher the number of the psoriatic arthritis registry. And as you can see, most of the registries are located either in North America or in Europe. In South America, for example, only Brazil has psoriatic arthritis registry. In Saudi Arabia, most of the registries that we have represent only single center registry. And there is no national registry. In United Arab Emirates, there is only one registry in Dubai. And as you can see in Asia, China, which has a population of 1.5 million, has only 3 psoriatic arthritis registry. So most of the information that we have from the registry represent European and North American patients, and we don't have information that represent the worldwide spectrum of the disease. This is why we need to have a registry that represents our population, our Saudi population, to know what are the manifestations and which treatments do the Saudi population respond to better than others. So in addition to that, unlike randomized controlled trials, registries usually represent the real-life situations. Randomized controlled trials usually exclude many patients with comorbidities. Also, the registries will help us detect rare events. For example, we wouldn't know that anti-TNF caused TB reactivation without registries. Pharmacovigilance, it will help us also with enhancing the safety and quality, and it will help the Ministry of Health to develop new policies and for resource allocation. So the registry was made through virtual meeting. We had 3 virtual meetings over 2 months. It included 2 rheumatologists, 1 dermatologist, 1 pharmacist, and 2 registry platform coordinators. Once the registry is launched, and a link will be sent through the MOH email to all the physicians, and you will be asked to activate the email. Once you activate the email, you will have this page. You will have to enter your phone number. You will receive a code number of six numbers. Then you will be asked to create a new password. This is the platform of the registry. You can see in the left side, under Select Registry, there is immunology. And under immunology, you will have the psoriasis and psoriatic arthritis. To add a new patient, you will have to choose the plus sign in the right corner, and then choose the immunology patient registration. You will be asked to enter the demographic data, and then you will have to select the registry selection and choose psoriatic arthritis. When you select psoriatic arthritis and enter the demographic information, you'll have this page, and you will have to choose the registry enrolled. You will have the psoriatic arthritis registry, and there will be categories, and each categories there are variables that you have to fill. For now, that we don't have the psoriatic arthritis registry. This is psoriasis registry as an example. Then after you fill the information, you will have to press on the psoriatic arthritis eligibility and approval, and then you will be asked to choose the medication. There are currently, there will be 3 medications in the registry: guselkumab, secukinumab, and upadacitinib, and only consulted rheumatologists who are registered will be allowed to enter these, to ask for this medication. So in the registry, there will be 91 variables, 51 are mandatory and 40 are non-mandatory. In the demographic, you will have to enter the phone number and email in addition to other information. Then you will ask to enter the psoriatic arthritis, date of diagnosis. You'll be asked to about the family history of the patient, and if it's first degree or relatives or others. Comorbidities are included in the registry, and it includes most common comorbidities are seen in psoriasis and psoriatic arthritis, like hypertension, dyslipidemia, and diabetes. Then you'll be asked to choose which domain does your patient have, peripheral, enthesitis, dactylitis, or axial. And based on the domain that you choose, you will be asked to enter the disease activity of each domain. For example, if it's peripheral, you'll be asked to enter DAPSA or MDA. If it's axial, you'll be asked to have the ASDAS CRP or the ASDAS ESR. You'll be asked also about psoriasis diagnosis and whether the diagnosis is made by dermatologists or not. The lab, there are several labs fields that you have to fill, but the most important variables are the TB test, whether a skin test or IGRA test, hepatitis B and hepatitis C screen. Then you'll be asked to fill the treatment history, and for each treatment, you have to mention the outcome, the adverse events, if there are adverse events or not. So when will the psoriatic arthritis registry? Hopefully will be launched in October 2023. At that time, you will receive the emails. So in conclusion, psoriatic arthritis is the first rheumatological disease to have a registry by the MOH, and it will be the first national registry in Saudi Arabia. It will help us to enhance the pharmacovigilance, create more advanced health policy, and it will help us also for resource allocation. The PSA registry will include 91 variables, 51 are mandatory, and the 3 medications that are included are guselkumab, secukinumab, and upadacitinib. Thank you.